Greetings, everyone. People often ask, what is CBD?
I get that a lot. I get that a
Yeah.
lot, Bob.
My name is Dr. Robert Quinn. I'm one of the co-founders of our company, PRISMM Earth. And we are here in this discussion today to cover some of the technical aspects as well as the patient questions that we all get having to do with CBD. CBD, of course, stands for cannabidiol. It is one of the cannabinoids that is in the plant, the cannabis plant itself. CBD is extremely popular now, but I really want to clarify something, and that is the fact that CBD is not the only part of the plant that gives us our therapeutic effects. As a matter of fact, the way nature made the plant, CBD is probably one of the weaker cannabinoids because the plant is balanced and there's more CBD in the plant than anything else, and that's what it takes to get that balance. So I like to tell people, when you're looking for a product, don't just look for the amount of CBD in there, because there are other cannabinoids. And as a matter of fact, we talk about full spectrum, which has got cannabinoids and it's got terpenes and flavonoids and esters and ethers and all of that kind of stuff in there. There's even vitamin K. Okay, so it is really important to have a full spectrum type of plant. And then, Dr. Crowder, I know people ask you that, and you always have great answers for that. Please chime in and tell us what you say.
So for me, I'm an orthopedic spine surgeon, Terrence Crowder. And the most important thing is people want knowledge. They want to know what's going on, what is CBD, what is THC. And so I initially just try to educate them on the very basics of what CBD is versus THC. And that CBD works at certain receptors in the brain and in the body. And those CB1 and CB2 receptors are very important when it comes to mind, body, function, emotion, gut, digestion, overall health, anti-inflammatories. There are just all these different things that those receptors do. And that CBD, whether that's one of the different CBDs or CBG, whether it's one of those or not, they actually act on those receptors in order to modulate those things to help the body. And so they create and help the body have a nice, fine balance. The thing that I always try to encourage the patients to remember is that disease and illness are an interruption of balance. It's all about that balance being interrupted. Why do we get diabetes? Because there's an interruption in the balance that exists for people. And so CBD and the endocannabinoid system help us maintain that homeostasis balance. And if we're able to figure out how to do that better, and I think there are lots of things that have, and there's a lot more research we need to do, it can actually be a game changer. And because CBD is a very natural product, and you will tell us more, hopefully, about how to find good, clean, natural products and different things, that it's something that can help people be extremely better than what they are, actually recover from illness and thrive versus just continue medications that are nothing more than drugs. And drugs maintain a drug state. You stay sick. Whereas I'm looking for a way to hopefully help people get better without getting sick, to get over their sickness and heal those problems they have.
Excellent. I'm glad you mentioned the receptors and that type of thing, because when we do get into the science, sometimes people do want to know that. Well, a question that really comes up often is, well, how in the world can you have a product like this and someone say it helps me with depression, someone else says it helps with pain, someone else says it helps my irritable bowel syndrome? How in the world can this happen? And what I tell people is, basically, it does one thing, and that's, as you say, homeostatic balance for the entire body.
Excellent. And I think that's the big part of it. And then on the other side of that question, they always want to ask me, what's CBD versus THC? Because patients are people, and those people, these are people with jobs or families or life. They're not looking to avoid what's happening. They have no interest in getting a euphoric high. There's a big stigma about that came with THC. So it's really hard for them to see themselves trying to get better. And they don't want to do that side of it. And could you, and I know what it is, but could you explain a little bit more of why THC, the brother of CBD, is so very different?
When we get to the molecular level, which a lot of times people don't want to go, but it's pretty critical, because THC, the tetrahydrocannabinol, actually will bind to those receptors that you mentioned previously, CB1, CB2. There's probably at least 20 different kind of receptors that this binds to. There's PPAR gamma and all of these technical things. CBD doesn't bind. CBD is what is known as a negative allosteric monitor. Now, what that means is it gets in the way and it changes the formation of the receptors. So, as they say, CBD does nothing that a touch of THC can't help. And that's where you get into the talk that you just mentioned about, will this get me high? No, will not get you high. If you want to be intoxicated from the cannabis plant, you need to find something that's high in THC, and that is obviously not what we're all about. We're looking for the therapeutics of this, and in order to get that, we have checked out numerous what people used to call strains, which are cultivars, and it has varying amounts of THC, CBG, CBN, CBD, all of these things, and we look for specificity when it comes to any type of malady that we're looking to go after. We're not looking for high THC concentrations. That doesn't really help us much.
Excellent.
Dr. Allison, I always like to talk to you about some of the patients that you talk to, that you treat, and some of maybe even some of the incidents that people have given you feedback on. And I'm hoping you can add something along those lines.
Mhm. Yeah, of course. And yeah, thank you. Great talking with you. Great to be here. A lot of my patients wonder, people ask me, why am I interested? Why did I help found this CBD company with you and Dr. Crowder? And it's because I'm a big believer that whether it's surgery or big pharmaceuticals, that these type of interventions are a last resort in treating pain. I believe in treating pain and these ailments that affect us in the most natural way possible and the least harmful way possible. That's what we were trained as doctors, and to this day, I still stand by that. Certainly, it's easy to give somebody a drug, an opiate, and we saw what happened with the opioid epidemic, or to say, oh no, just go in and have a knee replacement and it's done. And truth is, nothing is as good as the knee that God gave us. As much as we've gotten really good about replacing knees, for some people, that's not the right thing to do. There's sometimes where it definitely is the right thing to do, but not always. So I really wanted to explore this middle ground of ways in which we can help somebody in pain and not just tell them, oh, here's a Tylenol or here's a knee replacement, but that precious middle ground where we can give them something that works. And I saw very quickly, first, it was a patient that actually came to me and said they had tried it and had really noticed dramatic effects. And this patient was an engineer, not somebody I would have expected to be into holistic medicine. And I started looking into it. And fortunately, I met you, Bob, and I realized that you've dedicated your life to this and made this something that you want to do to help people. And then I saw the PRISMM, the delivery system that you've made, the fact that we've tested it. We test through third-party testers in a way that's more than any company I've ever seen or investigated, so that we know what we're getting and what we're giving to patients. And we're not giving them the THC. We're not giving them all the other byproducts that other companies might give. And we're giving them something that's going to work. And to me, I think, and I've seen it in the early orthopedic literature, that CBD has an anti-inflammatory effect. And we're all knowing the devastating effects of inflammation on the body. And so that's why another reason, in addition to homeostatic mechanism, that I think we can see where it can affect things other than just joint pain or other things, is that decreasing that overall inflammatory state of the human body is, we're finding to be very important. So this has been a revolution for me in my practice. And as much as I love to operate, I love happy patients even more, and especially patients that we don't have to do major interventions on. And this has done it. And even with my own mother, who's got crippling arthritis of the shoulders, we don't want to do shoulder surgery. I've given it to her, and it's been a game changer. I'm just grateful that we've got this product and be a part of the team.
Excellent, excellent, excellent. I know that You mentioned the opioids and the opioid crisis and all of that kind of thing, which is devastating to so many people and so many of us. And this is a viable option. This is not taking extra strength Tylenol. This is a very viable option that works very well. I always have to say that one of my pet peeves, though, is when a person is not educated. And as you mentioned, part of this process here is to help educate people. When someone is not educated and they may go to a dispensary and ask the dispensary agent or whoever is there, well, what should I do for this type of pain or something like that? And they get whatever is on the hot sheet there. Then they go home and they think, oh, well, that doesn't work for me. And to me, that's a crime. When we first started this, one of the premises was, this is medicine. We're going to treat it like medicine. It's going to help people like medicine. But again, they need the education. We can't let people go out there and flounder and just try things and have no idea what they're doing and then claim it doesn't work, because we know that the products work. So that's just one of my little issues.
Yeah, it's very interesting in that people will go to the grocery store or the pharmacy and they'll pick up Tylenol or they'll pick up ibuprofen and they'll take it with the greatest faith in the world that it will help them or make them be better. And they don't read the packet. I tell patients, I said, have you ever actually read the insert when it comes to your ibuprofen or your Tylenol? That aspirin in itself can be deadly to children, literally deadly to children. And that Tylenol is, if you take a high enough dose, is far more deadly than even Percocet because it will kill your liver. And it's amazing that people they don't know, they don't understand. It's a faith that's been created in society that Tylenol, because it has Tylenol and it's advertised as Tylenol, it works. Or ibuprofen because it works. And there are definitely benefits to those medications. Ultimately, though, they are, once again, chemicals that have been developed to help people be better. And the same people taking Tylenol think that Tylenol actually can help with inflammation, when in reality, as we've all learned, all three of us, that Tylenol is not really very good for inflammation at all. It doesn't really do a lot for inflammation, but patients will try it and people will try it, and they don't understand that it doesn't help them. And then I have to tell them, you need something that has an anti-inflammatory effect. And ibuprofen, if you're going to do it, would be better than Tylenol, or turmeric would be better than that. And it's very interesting how we bring up education and teaching people, but when it's not something that the pharmaceutical companies are making billions on, it's very hard to get that information out. Even with the internet and all the information that exists, there's also a lot of very false information. And so it's been wonderful to work with people who know and understand and work with the science of actually why this works and why it doesn't work. I tell every person that this doesn't mean everything's going to work for you. This is not a guarantee. No surgery is a guarantee. No medication is a guarantee. Only God's the only guarantee you have. And so if there is no guarantee, then you are taking this, into the best of our knowledge, we're pointing you in the right direction to do the right thing to be better. And so with CBD, we're trying to point them in the right direction with the best knowledge we have. And it's been excellent talking with you, Bob, on the numerous studies that talk about the anti-inflammatory effects of CBD. So, Bob, why is it that CBD is such a great anti-inflammatory? Why does it have such great anti-inflammatory effects?
That's a great question. Now we get all of the time. And what I have to say, and I tell people, is that CBD itself is what we call a negative allosteric modulator. And it actually works in the opposite way that the pain flows from the periphery to the central nervous system, the spine, and then to the brain. Pain is in the brain, and that's how we perceive it. When we use CBD, it actually buffers those nervous impulses in the opposite way, from the brain to the spinal cord, and then actually out to the periphery if that's your site of pain, right? This activity is what makes it very unique. This activity also takes a little bit of time to actually reach its peak. And that's why with the products that we make, we put in other ingredients, not just the CBD. When we're looking at pain, we put in a couple of things for inflammation. One of them is curcumin from turmeric. Another is an amino acid. We like to put amino acids in most of our products because we want to make sure that we are catching any type of deficiency that people may have that would add to this overall pain or inflammatory response. The one that we put in here is called phenylalanine, works very well for pain and inflammation. And then one of our favorite ingredients that most people have never heard of, and that's PEA, which is palmitoylethanolamide. This is a phenomenal chemical for both pain and inflammation. Tons of studies on this. This product, I think, originally came out in the 50s when they were doing experiments on it. And as I said, it comes from nature. We can get this from egg yolk, so it can't be patented. It's not going to be something that big pharma is going to use, and therefore most people haven't heard of it. Those of us have that are in this field and deal with this type of thing and pain all of the time, we like to have this as an adjunct to the CBD and the action that CBD has. So now we have products that what we call work in a multimodal effect. That's many mechanisms to stop this. That's why we believe that we have the best products out there.
Excellent.
And Bob, I had a question too, because I'm fascinated by the entire anti-inflammatory market, and really, I think the pro-inflammatory response of the human body is responsible for a lot of disease on multiple organ systems, and not just the ones that cause pain, but cardiac, neurogenic.
Yeah.
I heard you mention before about this. I've always thought about inflammation triggering nerves, and then you've talked about something that's really interesting to me in the fact that it can work the other way around as well. So I'll think of the bradykinin pathway and the interleukin pathways that stimulate nerves and reflect back pain. But we also know that nerves, like we see with people with neuropathy, can also affect inflammation on the other way, on the way back down. And you've indicated before that CBD can actually affect it from the top down. Can you go into more of that in detail?
Okay, sure. I'd be glad to. So if we look at the nerves and the nerve cells, what we're used to seeing in the medical world is a pain impulse from the presynaptic area. And that's where our pain signals go, from the presynaptic to the postsynaptic. And that transmits the pain and inflammation along those nerves that are going to eventually go to the brain. What happens with the CBD is absolutely phenomenal because it is released, and our endocannabinoids are the same. We can get into that, but they're released from the postsynaptic area of the nerve into the space and then block the presynaptic release of the chemical moderators of pain and inflammation.
Yeah, it's that delicate nuance, that play. And we've always been working on that presynaptic area. And this is where this is the difference. This is really exciting stuff. I'm excited that we're into this. I know with our academy, we've really done a lot. We're getting into more research, and this is becoming more of a mainstream. A few years ago, everyone thought all the doctors, all of the scientists were ignoring it. And now we know this is real. So I'm excited to see where it goes from here.
I have a comment on that, and I am so excited as well. First of all, I'm excited to have you guys with us involved in this because that is so critical. And as we know, you mentioned inflammation. Inflammation is a killer. Everything really is worse when there's inflammation. But the thing that's interesting that excites me is that if you think about it, medical practice, and this is not to knock anyone or anything, but medical practice is sometimes 10 years behind the science. And this, once the science exploded on this, medical practice began to accept it. And that tells me a couple of things. That tells me, first of all, that people are believing in the safety, which is absolutely critical because we all know that we'll never recommend anything that we don't think is safe. And then the efficacy. And that is how these things work. CBD works in a phenomenal way, and it's safe. So now the medical practice as you mentioned, Chris, is jumping on this saying, okay, yeah, we need to study this. We need to study this very closely. And let's come up with some real solid evidence for people out there who are either looking to try this, or their healthcare practitioners, the physicians out there who might be a little bit hesitant because of the old stigmas. But now, as you say, it's exciting because now people are understanding the value.
Yeah, that's a great point. And I've always been exactly like what you described. I've always been of the mind that the longer something takes to come to market, the more I trust it. What I don't trust is the fancy new drug that just came out, was just approved by the FDA with the minimum 2-year follow-up, and it's got a lot of marketing and push behind it. And we don't really know, because what ends up happening is you see at the 5-year, 6-year mark, all the side effects come in. And that's one value that I think CBD has, is it's been around 20 plus years where people have been using it. And we've seen that no severe adverse reactions. And that's a great thing for me. And I'm glad you brought that up, because yeah, the shiny new drug with all the marketing behind it is not always the right answer. Sometimes it's the lean horse for the long ride.
There you go. Yeah, exactly. Great point.
So, Bob, here's a very good question. I see CBD everywhere I go. I see stands. I see it in Walmart. I see it in Walgreens. It's on Amazon, on the internet. Why not get your CBD from the gas station?
That's a great question. And I think the main thing would be the sourcing. Where does that come from? And a lot of times they can't answer that question. They also can't answer, is that the CBD in there, is it in an active form? Is it an isolate form? What's going to be its benefit over anything else? And that's where I tell people, you have really got to do your research if you're going to take something like this. And I think you need to look at what is known as the certificate of analysis. And if you cannot get that from Walmart or any other seller, then I wouldn't buy that product.
Thank you. Thank you. What would be another question I routinely get is, and we've talked about this on multiple occasions, about the CBD, about the plant itself. Why does that need to be an organically grown product? Why does it need to be organic? There's so much out there about organic foods and all these organic things. Why wouldn't you want your CBD to be organic, or why do you want it to be organic?
Okay, another excellent question. I'll give you a little bit of information on why we want it to be organic, and that starts with the fact that this plant is used in different parts of the world to remediate heavy metals out of soil. It works very well. It's the second most powerful soil remediating plant in the world. So you want to have an organic product, because if you don't have organic, you don't know what's in it. And with the organic, we're going to get that certificate of analysis, and we're going to make sure that we don't have heavy metals in there and we don't have pesticides in there. Other people, if you buy it off the shelf, you may not get organic.
So are you telling me that in other parts of the world, and that CBD, the plant, is used to remove all the toxic waste from the soil?
Yes. If you remember that little place called Chernobyl, okay, they have got this plant growing all over the place to remediate whatever metals came out of there, right? What's funny is, and this is an aside, when the Daiichi Fukushima plant blew, they're not allowed to do that. So those toxins are still floating around, right? Chernobyl's a little bit different. They've pretty much cleaned that up because this plant is so strong with pulling metals out of the ground.
Wow. I guess it really does matter a lot.
Yeah. Exactly. And that's why we're very diligent on our, I guess you'd say, our sourcing. Where do we get things? What are we doing with this? We are dedicated to providing people the best quality product that they can find.
So and Chris, I'll ask you. So I've recommended to some patients and never telling them what to do, but always simply giving them the option of to use a CBD product. And I've had many patients go and buy PRISMM and use it. I've had them interact with the company, and I've got some great stories. I've heard some great things about how well it's done to help them with their pain. One of my favorite products is the CBD cream because I think it's a very good product, works very well, and it's direct contact with what hurts the most. Chris, what have you seen? You do a lot of knee and hip and orthopedics like that. What have you seen as far as patients anecdotally who've used CBD?
Yeah, that's why I'm here, and that's why I'm really enthusiastic about the company and going forward. Anecdotally, albeit, and we're going to put it together in a study shortly. It's been amazing. I'd say it wouldn't be 100%, but it's pretty darn close of patients who have been very satisfied, and many cases where they're thrilled. They're saying, "Thank you so much. Thank you so much for introducing this to me." The same result that I love to get from surgery, which has got me so psyched up for this product, is that same kind of thing. Because my bottom line, a lot of what we do in orthopedic surgery is to get people out of pain, especially when it comes to joint reconstruction. And if I can do that with a topical that they can put on that's a reasonable price and very safe, and it works and it's easy, that's like a grand slam. That's what's got me psyched. Anecdotally, it's been a very high percentage. I'd say a much higher percentage than what is the standard success rate for knee arthroplasty in the United States, which is approximately 80% satisfaction. This has been beyond that in my experience.
Okay, that sounds great. I'm like I said, I do spine surgery, and so interestingly enough, I'm telling people if you're gonna try it, rub it into the muscle. Don't just rub it on the skin. Take the 30 seconds or a full minute and rub it in all the way into the skin. Give it time to cross the barrier and get there. And I've seen the same thing. I've seen people say, I couldn't sleep at night, and yet they've used it and they're like, hey, I got 6 or 7 or 8 hours worth of sleep. It doesn't mean it was a miracle. It doesn't mean they had zero pain, but they went from life is really intolerable. This is a miserable pain to something that's maybe a little annoying, but nothing that's by any means in need of even a Tylenol or an ibuprofen anymore. And so I've had a few patients who've told me that they tried it on their back, and after trying it on the back, they tried it on other things. I have one patient, she has rheumatoid arthritis in her hands, and she loves to bake. She loves to bake. And she said it's really hard for her because when she goes to bake, her hands ache for days, or sometimes she can't get all the cooking done because her hands just hurt so bad from the rheumatoid. And she said she's used it. She was able to bake for Christmas and Thanksgiving. Her hands did fine. And I've never had a clue to even tell her to do that, but she did very well from it. I have 2 other patients who they've got bad ankle arthritis. And I mean, the kind where they limp, I do ankle surgery, but it's enough. And they said, yeah, I tried it on my ankle, felt good enough. They were able to get through their days and do pretty well. And so just from an anecdotal standpoint, in my experience, I've seen people do very well. Not every single patient. And I think some pains are just too much. I think there are things that it's too far. If you have something that's severe stenosis or severely pinched nerve or weakness, those things, we have to address them orthopedically through surgery. And that's just what we have to do. And we've been blessed with the opportunity to help people like that. But the vast majority of people I see don't need surgery. They need all these other things in life. You probably see even more of that than I do. What's your talk with them now when you see somebody with mild knee arthritis, but it's giving them misery? How do you get them through that?
Yeah, I mean, it's always been the same where I try to avoid knee replacement and hip replacement and other large joint replacement for as long as possible. And only when the pain is so severe and nothing conservative is working, then we go forward and consider surgery. But the problem I've had is to not have a lot of options. Like I said, just here's a Tylenol and PT, or here's a knee replacement. And I've really wanted to explore that middle ground. And opening this up, it's not a magic bullet, but CBD has really changed the game in terms of giving something else that works in association with PT and potentially some other things, offloading, weight loss, and it's made it where the non-operative route is really realistic. And that's just really exciting. And it engenders a lot of confidence in my patients who realize that I don't want to just run in and do a joint replacement, and we want to do what's best for them.
That's
Yeah.
great. It's one of the things that I always tell people, that I do spine surgery, and nobody wants to have back surgery. Though it's very successful with the right indication and the right patient in the right hands and expertise, people do very well. It's a very scary thing. And this has been a great option to give people that ability to say, hey, maybe we can help you avoid surgery altogether, or maybe avoid surgery for a really long time, or maybe help you get back to life. And I've also used it in people who, they have a surgical problem that we do have to fix. We don't have a choice. We have to do this. But then after that's all done, they still have some aches and pains or other things going on. And we use these products really to help them get to that really living life again. Their miserable pain is gone because of the surgery. And now that other achy arthritic pain we all see all the time, helping them get through it. That's been really helpful to use the product to help people get better.
You mentioned people getting better using the product, and we've covered what we would say is the hard science of this, the mechanisms of action, and the various things that we can measure, inflammation, pain, and whatever. There is something very unique about CBD that people don't talk about too much. People that are in pain and have experienced it do understand, and that is dissociation. This CBD actually has the ability to mentally allow us to step aside and view pain from the outside. It's real different. The only thing I can come up with that's like this is, if you've sprained an ankle, the very first time you do it, you think the world's coming to an end. You're never going to walk again. Then you do it again, and you go, yeah, I know what to expect. I'm not going to worry about it. Yeah, I'm going to be able to go to work tomorrow, whatever it is. You understand what it's about. And that's a dissociative type of activity, because you go, yeah, that's my ankle. It's going to heal. The first time it's, oh, I've had it. Okay. So it's a dissociative thing. CBD does that. It helps you to dissociate. And as they say, walk alongside the pain. Don't let it consume you.
So here's a really good question. Some of my patients, they do work, they have jobs, and they're active people, and they get drug tested. Does CBD show up on drug tests?
CBD will not. It will not show up on drug tests. Actually, what shows up, I'm trying to remember the chemical name. It's a breakdown of THC. When they do the drug testing, they don't test THC. It's what's broken down. Now, one of the problems that I talk about with this is that different labs test differently. They have different amounts. They have different normals. We know this from other things, whether it's a metabolic panel or something. The norms can differ based on the lab. And that is exactly what happens in testing labs. And that's why people are so up in arms about this. But to answer the original question, no, CBD will not show up. It does not break down into that exact same chemical moiety that THC does.
Will it cause you to have a positive test for THC then? Even though you've taken CBD, will it show up as THC?
No, that's a great question. The original chemical in the plant is CBG. CBG breaks down into CBD and THC. CBD will not break down into THC. There is a misconception where there was a couple of studies out years ago that they've completely disproven, where someone said they took CBD internally and it broke down into THC and all of this. That is false. CBD cannot do that. You can't make it do that in the plant. You can't make it do it in a test tube, and you certainly can't make that happen inside a human.
Now, there is the concern for other companies that don't appropriately test the way that PRISMM does, in which they have excessive amounts of THC leaked into their product. And I can see, I think that's where Dr. Crowder is going with this. And so that's one of the things that gives me a lot of confidence in PRISMM, is the fact that you've went to great lengths to make sure we're tested and that we have the appropriate distribution where it's CBD. We're not letting THC get in there.
Yeah, exactly. And I should point out, when I talk about the certificate of analysis, that's not just something that we look at and tell people, oh, trust us. No, we put the actual certificate of analysis on our website. So if people want to see it, they can see it.
Wow, that's great. That's very interesting that you say that, Dr. Allison, because that's a main concern. If you are there are people that are police officers, or they are pilots. They are people that have very intense jobs, and they are routinely drug tested because it's a part of the job. And that's a major fear. And these people, they have jobs and they have pains and they have things that hurt and bother them. And if you're a pilot with a bad neck or something to that extent, or if you're a police officer with a bad knee, that it makes a difference to know you can use something, be able to get out there, get better, do your job, and that you're not going to get in trouble in your job because you have a quality product that's been tested, and that you're not concerned about having a positive test that is actually false or some other complication. So it does make a very big difference where you get your product and which company you're getting from.
100%. Concur.